Polycythemia vera, or PV, is a rare chronic blood cancer that is often overlooked. 40 to 60% of untreated patients may develop blood clots during the first 10 years after diagnosis. But there are treatments available and signs to look out for. So here now with PV treatments is Dr. Brandy Reeves, along with Gary, a PV cancer survivor. So thank you both for being here. Dr. Reeves, can you share with us what polycythemia vera is and what are the typical symptoms?
Sure. So polycythemia vera, or PV for short, is a chronic blood cancer that causes the bone marrow to produce too many mature blood cells. And these are especially red blood cells, but also white blood cells and platelets. And this leads to the blood flowing through the blood vessels to be too thick, similar to a car engine with old motor oil. And that can lead to problems such as blood clots, including stroke, heart attack, blood clots in the legs, blood clots in the lungs, and blood clots in the belly. And there are also other symptoms that patients may experience, including fatigue, itching, especially with a hot bath or shower, burning or tingling in the fingers and toes, concentration problems that people often refer to as brain fog, or feeling full after just a few bites of food. And over time, the abnormal PV stem cells in the bone marrow can lead to scarring, which we call myelofibrosis. And ultimately, they can change into a very aggressive form of blood cancer called acute myeloid leukemia.
All right, now, Gary, tell us a little bit about yourself, including your diagnosis journey.
Sure. So I live on Cape Cod. I've been an avid hiker all my life. I've been a teacher for my career. And when I was hiking, I would get this burning in my toes that I assumed was a part of hiking. And maybe my shoes didn't fit right. Maybe I just needed to massage them. That burning in the toe started to come more frequently, especially when I wasn't hiking. So I went to a podiatrist first because I figured it was just a foot issue, and had inserts and insoles put in. That didn't help. Eventually, my primary care ordered up some blood tests. Those blood tests came back with a JAK2 mutation, indicating that I had ET, which is a type of MPN. And then it was basically I was seeing a hematologist, and they said I was just going to watch and monitor my platelet levels, but I didn't have to do anything. My wife didn't like that watch and wait approach, so she found an MPN specialist in Boston at Mass General. We went up there, consulted with her. She did some more blood tests. We had a bone biopsy done, and it confirmed that I had polycythemia vera. At that point, I started taking baby aspirin, 81 milligrams a day, as well as doing therapeutic phlebotomy twice a month. I would feel better after phlebotomy, but after a year, it wasn't working. The hematocrit level wasn't coming down, and the red blood cell count was actually going up. So in the spring of 2022, I consulted with my doctor again. We had some very candid conversations about treatment plans and treatment options. She recommended Besremi. So I started that in the spring of 2022. By September of 2022, my blood levels were normal. The blood counts were normal. We continued with the same dosage, I think about almost a year. And then we went down to, rather than every 14 days injecting every 28 days, which is what I do now. And it's a small needle. It's subcutaneous. It's just a small needle that goes under the skin. I'm afraid of needles. This wasn't, with training, this was very, very easy. A whole lot better than doing therapeutic phlebotomy.
So Dr. Reeves, this is actually the first I'm hearing of this cancer. Can you share a little bit more about what treatments options are out there for PV?
The presently the only cure for PV is a stem cell transplant, which is generally considered too risky because the overall survival in PV is expected to be 13 plus years. And so as such, our goals of treatment are really to reduce the risk of blood clots and improve symptoms, while not increasing the risk of progression to myelofibrosis or acute leukemia. And so our current treatment guidelines recommend a baby aspirin for all patients to help reduce the risk of blood clots and to also maintain the hematocrit less than 45%. And that can be done with therapeutic phlebotomy, as Gary had, where you have a blood donation to the garbage can, or with medications to reduce the blood cell counts. And those preferred frontline medications who need more than just phlebotomy are a chemotherapy called hydroxyurea, or the injection under the skin called Ropeg interferon alpha, which is also known as Besremi. And the big difference between these two treatments is while they both reduce the blood cell counts, only Besremi targets the source of polycythemia vera in the bone marrow. And which treatment option we recommend ultimately depends on patient factors such as age and other medical problems, in addition to patient preference.
So, Dr. Reeves, what are some of the side effects that you've seen with Besremi?
Besremi is an interferon alpha. And interferon alpha is naturally produced by the body in response to viral infections in some cancers. And so, unsurprisingly, then the main side effects are flu-like symptoms, including tiredness, weakness, fevers, chills, muscle aches, and joint pain. Some patients may experience itching or sore throat, and there are some interesting side effects, including depression, anxiety, autoimmune problems, and heart problems that we keep a close eye on as well.
And what would you like others living with PV to know?
Yes, I would suggest finding an MPN specialist and somebody that really knows the cancer and the treatment options that are out there, and also to connect with patients that are also dealing with what you're dealing with PV, or even dealing with another MPN, any type of blood cancer that's under that MPN umbrella. It's good to talk to them and share what's going on with you. It's been very helpful for me.
All right, this is all great information. Where can we go for more?
Yeah, so for more information about polycythemia vera and its cousin diseases in general, a great source is the MPN Research Foundation.org, and also Leukemia Lymphoma Society, which is LLS.org.
All right, thank you both so much for being here.
Thank you.